I just wanted to talk to you about the recommendations for before your vasectomy procedure and how to get prepared and what the risks and benefits and frequently asked questions. Do eat and drink before the procedure. It's local anesthesia. You don't have to worry about general anesthesia and the different effects for that. Do bring some kind of supportive undergarment, tight underwear, compression shorts, bicycle shorts, something that's going to keep the testicles elevated rather than hanging. If they're hanging, they're going to hurt more. And continue that for the first 2 weeks after the procedure. I do a modified no needle, no scalpel technique. The no needle is a pressurized jet injector that fires a spray of local anesthesia, anesthetic into the tissue. I then use a needle to provide more fluid as a longer lasting effect. The no scalpel, I make a puncture into the scrotal skin. I pull up each vas individually, cut out a segment, burn both ends, clip both ends, and do that in a way so that there's tissue in between. 4 different things to keep both ends apart, but that being said, it's not 100% effective, it's over 99% effective, and one of the best methods for contraception. The only ways to get to 100% would be castration or abstinence. I'm sure you don't want either of those. There's other non-permanent methods for contraception, and you could freeze sperm as a backup plan prior to the procedure. Again, that's prior to the procedure, you can freeze sperm. You should, let me go back to my list. So any reasons why you shouldn't have the vasectomy, if you have any doubts about the procedure, you're not ready for the procedure. Go ahead, take more time, think about it. How to prepare, you should definitely, prior to the procedure, day before, shave the scrotum with a fresh razor. Fresh, clean razor, not clippers. Clippers eat up the scrotum. You get more nicks from that. And the procedure is performed in the upper midline part of the scrotum. So if this is the penis here and the scrotum is down here, the little incision is right in the middle, just underneath the penis right there. So that's where we want clean. But also any hair on the side of the penis that's long enough to come down, that should be shaved too, because that can get in the way. It's safe to bring music and headphones, that's no problem. What to expect after the operation procedure, it's going to feel like you get kicked in the balls, okay? It's going to ache. That's why I do them on Fridays, so that you have the whole weekend to recover, relax, ice pack, ice pack, ice pack. Can't say that part enough. Bruising is normal. That's expected. Some swelling, definitely. Keep the area clean and dry. There's no suture or anything to come out. It's just that skin puncture, so that'll close up on its own. You put antibiotic ointment on it 3 times a day. No strenuous activity after the procedure for 1 week. No ejaculating after the procedure for 1 week. Again, no ejaculation 1 week. Most importantly, use another type of birth control until you have the lab test that says that you're clear, that there's no sperm or rare non-motile sperm. Not everybody clears on the first sample. So again, you have to pay attention to the result to make sure that there's no sperm in the sample or rare non-motile sperm in the sample. All right. As far as medication, let's talk about if you take any blood thinners, but I will prescribe you an anti-inflammatory pain reliever called Celebrex. It's every 12 hours. It's a nice pill to kind of prevent. I tell you to start taking it before the procedure to kind of prevent some of those pain and inflammatory cascades that start working before it even happens. It's not always covered by insurance or may require prior authorization. However, it's only 8 pills, 4 days worth of medication with our GoodRx.com prescription savings card. You can go to the website, but it's probably $20 to $30 and not worth going through all the paperwork or hassle to get the medication. If you still have pain or on top of that, I recommend using Tylenol Extra Strength, 2 pills every 8 hours to control the pain. If you have terrible pain, that's not controlling it, give us a call, we can send you a narcotic. But with narcotics, it causes constipation, nausea, headaches, hallucinations, you can't drive with it. So we try to avoid the narcotics at all possible. when can you go back to work? You can go back on Monday if you have a desk job. Again, no heavy lifting for 1 week, but if you have a desk job and you can take it light, then Monday's no problem. What are the risks of the procedure? Bleeding, infection, sperm granuloma, and chronic pain. All of these are small risks, but all still possible. So that's why we still mention them. What happens to the sperm after procedure? It gets reabsorbed within the testicle. So you're not going to notice the difference. You will notice some increased fullness within the epididymis and testicle, but that's about it. And then will the procedure affect your sex life? No, it will not. In fact, you're not really going to notice some big difference because sperm is only 2% of what comes out. So not going to notice a big change. And then finally, the last part of the information form talks about how to do the semen analysis after the procedure. The instructions are there, and just remember, you do not have to fill the entire container. All right? So those are your tips for the vasectomy procedure. Good luck.